seconds. Okay, now we're live. All right, so hello everyone. Today we're talking with Samantha about the last workshop. Samantha, can you introduce yourself and let our guests know a little bit more about yourself?
Sure, my name is Samantha Saborio. I'm a clinical psychologist specializing in anxiety and depression, and I've also been working for the past 2.5 years at VRDHealth Tech, a company that provides digital solutions for health. We focus on integrating technology like virtual reality into therapeutic settings.
Lovely. Um, and have you got any personal experience of working with VR with your clients?
Yes, I have. Actually, through my role at VRD, I constantly use VR, especially for evaluations, but I am really excited about trying out PsyTech.
Okay, that's fair. Uh, Quick question about the workshop that you attended. So, what actually motivated you to join this workshop?
Well, given my work, I'm constantly looking for new science-based tools to support mental health care. I attended the workshop to deepen my understanding of how VR can be used specifically within CBT frameworks and to explore how to apply it into a real, like, clinical setting.
Mhm. Okay. I think Dr. Rorik and Dr. Smith they did great job. I did a couple of other interviews, talked with the therapist, psychologist, psychotherapist who attended it. My question for you would be, what's the best part of or what's the best thing you like about this workshop?
Well, I was actually amazed about how practical and customizable the VR scenarios are.
Good. So next question would be, so for those therapists who just start and plan to use VR, what would you recommend them? So maybe taking a part of this workshop, or maybe you have some general VR recommendations.
And I would definitely recommend the workshop. It's a great way to learn how to bring innovation into your clinical work without actually losing the foundation of evidence-based practice.
Good. That's it. So I think I got the list of my questions to 505. So Samantha, thanks for your time today. Really appreciate you joining us and have a great day.
Thank you. You too.